Hello viewers, thank you for tuning in again to Afya Jimudu TV, your health education channel. My good name is Wamadhai Jogona, a reproductive health specialist. We shall be discussing the causes, prevention and treatment of urinary tract infection, or commonly known as UTI, amongst the elderly population. We shall begin with the causes of UTI amongst the elderly men. Number 1, with age or as men age, the prostate gland usually increases in size, and when it does, it is likely to obstruct the urine pathway. And when it does, when he is voiding out urine or passing out urine, there is a tendency of some urine being left behind in the bladder, whereby they form a pool. And within this pooling of urine in the bladder, bacteria will collect there, and it will have room to grow, since their flow of urine out of the body is poor, and thereby it is likely to bring about the urinary tract infection. It is also good to know that if this man during his youthful age he acquired an sexually transmitted infection which was not treated promptly, then the chances of them developing a urinary tract infection again are very high, since the STI, although it was without signs nor symptoms, it happened to have injured or destroyed the urethra, thereby creating more room for other infections and also strictures. Usually what infections do, whenever you feel pain, it's similar to what you have on your skin. When your skin has a wound on it and you happen to touch, there is pain. So when you are feeling pain inside your body, it means there is a wound. So what happens on your skin, when you have a wound, it tends to adhere to clothing, and sometimes it's very painful when you are trying to detach them. So the same happens inside your urethra. When the urethra is injured, it happens to adhere together, thereby obstructing the urine flow completely. Sometimes we have a name for it, we call it strictures, and sometimes going through these strictures might see the patient being taken to theater, because then it can only be done under general anesthesia. So also this man, if it happened that during his youthful age he happened to have had an accident whereby the urethra was injured, the same is likely to happen. It is also very good to have it in a picture that if this patient has diabetes mellitus, which is not well controlled, then again infections will come, thereby bringing about UTI amongst other infections. So those are the common causes of the UTI amongst the elderly men. And when I say the elderly men, I mean the group of people who are not sexually active. We now move on to the causes of UTI, that is the urinary tract infection, amongst the elderly women. Usually when women are postmenopausal, that is without using any method of family planning, and there is loss of menses for a period of over 1 year, and this woman happens to be above the age of 45, then there is a loss of a hormone called estrogen, which is very supportive in many ways. But in this scenario, we shall be discussing the loss of estrogen and the UTI, the relation of loss of estrogen and the development of UTI. So amongst the postmenopausal women or the elderly women, what will happen is that the genital tract will become dry, and when it is dry, then wounds are likely to develop around the genitals, and when they do, then bacteria infection will invade, and when it does, Since the area is around the urinary tract, it is likely to bring about the urinary tract infection. Also, to remember, of importance to remember is that if this woman had sexually transmitted infections which went without treatment, since she did not have signs nor symptoms, they might also bring about the urinary tract infection. So it is always good for people to be screened regularly and also get treatment promptly. The other reason is the chances of them having diabetes mellitus type 2, which is also likely to make them prone to infections, especially the urinary tract infection, and the sugars ought to be controlled if she is diabetic. And also there is also the need of being screened for to rule out the possibility of an existing diabetes mellitus for those who are known not to be diabetic. The other causes of UTI in both the elderly men and women is the possibility of them initially having had a recurrent urinary tract infection. So when they age, the scenario tends to become worse. The signs and symptoms of UTI, that is the urinary tract infection, amongst the elderly. The commonest is pain or burning sensation when passing urine. The second one will be a problem of not being able to pass urine. The other one will be passing urine frequently, though in small amounts, and sometimes they feel like they are not voided all the urine. So those are the commonest signs and symptoms amongst the elderly men and women. We shall look at how we can prevent them from developing urinary tract infections. The prevention of UTI amongst the elderly is better than cure. So how do we go about preventing the elderly from acquiring and developing urinary tract infection, that is the commonly known UTIs? One, they ought to be screened regularly. And by screening, I mean some of these tests are quite affordable. We have the urinalysis, which will be able to tell whether there are infections or whether there is a kidney damage. We also have the basic ultrasound, which is not expensive and it is not invasive. It will tell whether the urine pathway is okay, that is the bladder is okay, the ureters are okay, and also the kidneys are okay. It is also good to have them screened for diabetes mellitus, which is also another affordable and a simple test to conduct. Also, it is good to have them screened for the men, the elderly men. They can be screened for benign prostate hypertrophy, which is usually an enlarged prostate gland that is associated with a poor flow of urine. For the elderly women, it is good to have them screened for cervical cancer, even if they are postmenopausal. It is good to rule out the possibility of masses or tumors in the genital tract that might be applying pressure to the urethra and also obstructing the flow of urine thereby. Treatment of an existing UTI which had no symptoms or had symptoms, it ought to be treated promptly and timely to prevent the future recurrence and complication of the UTI. Remember that when they age, they tend to become senile, and just like the child below 5 years of age, you might find that there is a need of the caregiver, or the caregiver has to come in to be cleaning them again, just like you are used to be cleaned in early childhood. And remember always, we have to clean them from the front going backwards to prevent the contamination of the genitalia by the stool. And for those on diapers, it is good to routinely change the diapers. The treatment for UTI in the elderly. We have found an opportunity to treat UTI in this elderly group that will comprise of both men and women. It is good to remember that they are host to many other infections, be it in the gums of the mouth, be it in the throat, be it in the lungs, be it in the alimentary canal or the intestines. So we have the opportunity of trying to cover all these would-be infections to limit them having to come or getting sick quite oftenly. It is also an opportunity where we can get to screen them for diabetes, we can get to screen them to check their blood pressure, and also to rule out other possible ailments that went undiagnosed before we come to the treatment of UTI which had symptoms that is pain when passing urine or inability to pass urine, or including pain in the lower abdomen. So to get the prescription, you can send 150 Kenya shillings via M-Pesa pay bill number 406795. The account is U.T.I. It is registered under Health Translated. Until our next health educative shows, please remember to subscribe, comment, and share. See you in our next educative health shows.